Hello, welcome back to my channel. I am Dr. B.S.Arora, psychiatrist by profession. Today, I will discuss about very important issue. What is psychotherapy and what is cognitive behavior therapy? People ask us repeatedly these questions. What is psychotherapy? In the realm of mental health treatment, and the psychotherapy and cognitive behavior therapy stand as a two major pillars, offering profound insight and effective tool for an individual grappling with the various psychological challenges. In this video, I will divulge into the depth of psychotherapy CBT, exploring their origin, principles, techniques, effectiveness, and application in the today's world. What is psychotherapy? Psychotherapy often refers to simply as a therapy, encompasses a range of therapeutic approach aimed at helping individuals overcome emotional disorders, behavioral issue, mental health disorders. Rooted in the work of influential figures like Sigmund Freud, Carl Jung, and Alfred Adler, psychotherapy delved into the complexity of a human mind, emotions, and the behavior. Freudian psychoanalysis, Sigmund Freud's pioneer work, laid the foundation of modern psychotherapy with his theory on unconscious mind, defense mechanism, and psychosexual stages of the development. Analytical psychology, Carl Jung expanded upon the Freudian's idea, introducing the concept of collective unconsciousness and the archetype, which remains central to the Jungian therapy. Individual psychology, Alfred Adler focuses on the role of social dynamics and the pursuit of superiority in shaping the personality, paving the way for Adlerian therapy. What are its core principles? Therapeutic relationship is a central to all form of psychotherapy, is a bond between the therapist and the client, characterized by empathy, trust, and confidentiality. Insight and the awareness, psychotherapy aimed to increase the self-understanding and the insight into the one's own thoughts, emotions, feelings, and the behavior, fostering personal growth and psychological resilience, uncovering the unconsciousness process. Freudian approaches and emphasis bringing the unconscious conflict desire into the conscious awareness to promote healing and integration. Its major techniques are free association. Clients are encouraged to speak freely without any censorship, allowing unconscious thoughts, conflicts, emotions to surface. Dream analysis, exploring the symbolism and underlying the meaning of dreams, can provide insight into unresolved issues and unconscious conflicts. Interpretation, therapists help the client to interpret their thoughts, feelings, behavior in the light of psychological theories and the framework. Cognitive behavior therapy, that's known as CBT. CBT represents a structured, goal-oriented approach to psychotherapy that focuses on the interplay between thoughts, feelings, and the behavior. Developed by Dr. Aaron Beck and later refined by Dr. Albert Ellis, CBT emerged as one of the most widely practiced and empirically supported form of therapy. What are its theoretical foundation? Cognitive restructuring. CBT posits that maladaptive thoughts, beliefs contribute to emotional distress and dysfunctional behavior. By challenging and restructuring these cognitive distortion, individual can alleviate symptoms and improve coping skills. Behavioral experiment. CBT incorporates behavioral techniques such as exposure therapy and behavioral activation to help the client to confront fears, test the assumption, and develop adaptive behaviors. Collaboration and the homework. Client actively participate in therapy by completing homework, assignment, and practicing new skills so that it can apply in real life situations. The principles are present focused and the solution oriented, unlike the traditional psychoanalysis, which may deliver extensively in past experiences. CBT focuses addressing the current problem and developing practical strategy for change. CBT relies on scientific research, evidence-based practices, guide treatment intervention, ensuring effectiveness and accountability, self and skill building and education. Client learn skills for identifying and challenging negative thinking pattern, managing emotions, modifying behavior through the structured exercise and educational material. Its major techniques: cognitive restructuring, identifying, challenging the cognitive distortions such as black and white thinking, catastrophizing, personalizing through evidence-based technique like Socratic questioning and thought records. Exposure therapy, gradual exposure to feared stimulus or a situation coupled with relaxation methods and a coping strategy to reduce the anxiety and desensitize the individual to their fears. Behavioral activation, encouraging activity, rewarding social interaction to counter depression and increase the feeling of pleasure and accomplishment. Comparing psychotherapy with CBT, while both psychotherapy and CBT share the overarching goal of promoting psychological well-being and personal growth, but they differ in their theoretical orientation, therapeutic techniques, and the treatment approaches. And what are its philosophical underpinnings? Psychotherapy rooted in the depth psychology, psychodynamic theories. Psychotherapy explore unconscious process, childhood experiences, interpersonal dynamics to foster insight and self-awareness. But CBT, grounded in the cognitive and behavioral principle, CBT emphasizes the role of cognition in shaping emotions, behavior, with the focus on identifying and modifying maladaptive thought patterns and the behavior. Its technique: psychotherapy emphasis such as interpretation, exploration of transference, dream analysis to uncover unconscious conflicts and promote insight. But CBT utilizes structural exercises, cognitive restructuring, and behavioral experiment to challenge dysfunctional belief and the habit, cultivate adaptive coping strategies. The treatment duration and the focus: psychotherapy typically long-term, exploratively in nature. Psychotherapy may divulge into the client's past experiences and relational pattern to address underlying issues and facilitate deep-seated changes. But CBT often it is a briefer, more focused on the symptom reduction and skill building. CBT targets specific problems and utilizes a structural intervention to achieve measurable outcomes within a relatively short time frame. Its effectiveness and applications: both psychotherapy and cognitive behavior therapy have demonstrated efficacy in the treatment in a wide range of mental health conditions, including depression, anxiety, PTSD, and eating disorders. Moreover, they have been adapted and integrated into various settings and the population, including individual therapy. Traditional one-to-one therapy sessions provide a supportive and confidential environment for a client to explore their thoughts, feelings, behavior with a trained therapist. Group therapy in group setting offers an opportunity for an individual and interpersonal learning, social support, skill practice, particularly in the area of anger management, addiction recovery, and interpersonal effectiveness. Couple and family therapy: therapeutic intervention involves couple or a family members to aim to improve communication, to resolve conflict, strengthen relationship by addressing underlying dynamics and the pattern of interaction. A specialized population: psychotherapy and CBT have been adapted for specific populations such as children, adolescent, older, LGBT communities, and individuals with co-occurring disorder. This is there to help their needs. In the end, psychotherapy and cognitive behavior therapy represents two complementary approaches to mental health treatment, each offering valuable insight and evidence-based technique for promoting emotional well-being and the personal growth. Whether diving into the depth of unconscious mind, challenging cognitive distortion and maladaptive behavior, therapy provides a safe, supportive space for individuals to explore, heal, and transform their life. as the field continue to evolve and innovate, the integration of diverse therapeutic modality and expansion of access to the mental health services hold promise for more holistic and inclusive approach to the psychological care. Until the next time, take care, prioritize your well-being. If you are having any question regarding this, you can email us, you can WhatsApp us, you can visit our website. I am sending you a link. Download it by clicking it, read it, fill it and submit it so that I can have your feedback.